हेलो एवरीवन, वेलकम टू मेड डिकोडेड बाय डॉक्टर अबुल। सो आज हम प्रीवियस क्वेश्चन जो एक हमने डिस्कस किया था, तो उसके बारे में थोड़ा बहुत आज हम लोग डिस्कस करेंगे, राइट? सो गोइंग टू द क्वेश्चन, वी हैड अ 26-year-old फीमेल, राइट? Again, she had typical lesions of an autoimmune disorder like fever, oral ulcers, facial rash, and discoloration of the soles, right? So as you can see in the photo, this was an actual patient जो हमारे पास आया था. The complaints were of since 3 months, right? So she had palatal ulcer, she had purpuric lesions on the sole, and she had malar rash. Okay. So as we did the workup, we found out in hematology she had pancytopenia with MCV was slightly decreased, but MCH was normal, and the counts were 2100 and platelets were 66,000. तो उसको पैनसाइटोपिनिया था. Again, the ESR was high, CRP was negative, suggestive of an inflammatory disorder rather than an infective etiology. Biochemistry, we had high ferritin with low iron with normal TIBC, suggestive of anemia of inflammation. So everything was pointing out towards an inflammatory disorder. And so we did their autoimmune profile. We found out that ANA-IF was positive. Again, 2 antibodies were found positive. First was anti-histone antibody and second was anti-Smith antibody. So now moving on towards the question, हमने देखा the urine examination was normal. Again, we expected a bit of proteinuria, right? So the most likely diagnosis was systemic lupus erythematosus. Now many of you commented that antihistone is positive, so could the answer be drug-induced lupus? Now remember, drug-induced lupus के लिए you have to have a history of drugs. Which are the drugs? That is the SHIP drugs. You know, SHIP means sulfasalazine, hydralazine, isoniazid, and procainamide. Then again, there are many other drugs which can cause lupus-like symptoms, but these are the main drugs: sulfasalazine, hydralazine, isoniazid, and procainamide, right? So these are the few drugs which cause. So अगर ये drug का history है and you have an antihistone positive, then the answer would be drug-induced lupus. Now, quick revision about antibodies in SLE. This is very important for your NEET questions. Now, remember, SLE is also called as the great mimicker, right? Now, ANA antibody, as you all know, it is for screening. So it is against the nuclear antigens like dsDNA, histone, Smith, RNP, ROLA, etc. So it has 95% sensitivity and the specificity is low. Right. So in any autoimmune, you can get a positive ANA. So it is used as a screening test and it is positive in almost all SLE patients. So out of 100, more than 95 if the patient has SLE, तो ANA पॉजिटिव होगा. हमारे पेशेंट में भी ANA पॉजिटिव था, right? As you know, ANA by IF was positive. Now the question was about 2 antibodies. One is anti-dsDNA and anti-Smith. Now many of you said an antihistone. Many of you said antihistone positivity. Now remember, antihistone positivity has high specificity for drug-induced lupus, right? But you can have antihistone positive in SLE as well, right? Because nuclear antigens में से एक antigen होता है histone. So it has high specificity for drug-induced lupus, but SLE maybe it can be positive. The more important thing is anti-Smith. Now we had anti-Smith positivity. The specificity is very, very high, more than 95% specific for SLE. Anti-dsDNA is sensitive in 30 to 60%. अगर यही क्वेश्चन में anti-dsDNA पॉजिटिव होता तो the answer would be, majority of you would have answered about drug-induced rather than drug-induced SLE. तो सेंसिटिविटी का मतलब अगर 100 है तो उसमें से 30 से 60% पेशेंट्स, लाइक 30 to 60 पेशेंट्स आउट ऑफ 100 might have positive. Remaining 40% can have anti-dsDNA negative in lupus as well. So that was the trick. Okay. Now remember, SLE is again anti-dsDNA high specificity for SLE, but sensitivity is only 30 to 60%. Disease activity के साथ correlate करता है and associated with lupus nephritis. These are the 3 important questions which are being asked. Anti-Smith, again highly specific, and it is rare in other diseases. So because of positivity of anti-Smith, we labeled the patient as SLE and we treated her accordingly. Antihistone, it is associated with drug-induced lupus, as we know. Which are the drugs? So the answer is the SHIP drugs. Okay. Anti-Ro and anti-La. Again, the sensitivity is low. Specificity, they are more commonly associated with Sjogren's syndrome. So they can be associated with photosensitivity, cutaneous lupus, congenital heart block. This is the question, right? Congenital heart block के लिए कौन सा antibody है? So you get anti-Rho. Again, anti-SSB or anti-La associated with Sjogren syndrome can be seen in SLE. Antiphospholipid antibody syndrome. So it is associated with recurrent thrombosis, pregnancy loss. It can present as primary APLA or it can present as secondary APLA. कौन से तीन antigen है? That is cardiolipin, beta glycoprotein 1 and phospholipid protein complexes. This is the question, right? Now you have anti-ribosomal P antibody. So P, remember, P is for psychosis. So agar lupus SLE mein you have psychosis, so it is likely associated with anti-ribosomal P antibodies that is associated with neuropsychiatric lupus. So now at a glance, if we see the antibodies, सबसे ज़्यादा sensitive is ANA, सबसे ज़्यादा specific is anti-Smith, more than 95%, rarely associated with other. Disease activity and lupus nephritis, you have got anti-dsDNA. Drug-induced lupus, SHIP drugs, anti-histone antibodies. Neonatal lupus or congenital heart block, anti-Rho antibodies. Thrombosis and abortions, you have got APL antibodies. And neuropsychiatric lupus, you have got anti-ribosomal P antibodies, right? Now mnemonic again, SLA is ANA plus anti-dsDNA plus Smith. ANA is screening, dsDNA is confirmatory. उसमें से भी Smith is more specific, dsDNA is associated with nephritis, right? Remember dsDNA N for nephritis, so you can get correlates with disease activity in nephritis, right? DANA, that is disease in nephritis, right? So disease in nephritis antibody DNA, right? You can have it correlates with lupus nephritis. So these are the few key points. Quick revision: 95% ANA positivity, Smith specific, dsDNA with disease activity, and APLA associated with recurrent thrombosis. So this was a trick question. Hopefully it is important, and this is a quick summary of antibodies. You can review it whenever you feel free. Thank you.